Evening is one of the most important times of the day for people with joint pain, but it's also the most overlooked. By the time you get home, you're tired, you've been carrying the weight of the day, physically and emotionally, and your body is quietly paying the price. For many of my patients, stiffness doesn't just show up in the morning, it's there in the evening too, especially after hours of sitting, standing, or moving in the same repetitive way. That's why I often teach a simple evening routine that doesn't require equipment, doesn't take more than 10 minutes, and can be done right in your living room. The goal is not to work out, it's to gently prepare your joints for a night of rest and repair. One of the main reasons joints feel stiff at night is that throughout the day, small amounts of inflammation and muscle tension build up. Imagine your joints as hinges. If they've been used all day without being oiled or gently moved through their range, they start to feel tight. A short, intentional routine helps circulate synovial fluid, the natural oil in your joints, and signals your muscles to relax. This not only eases pain before bedtime, but can also help you wake up with less stiffness the next morning. It's like sending your joints to bed on a soft pillow instead of a cold, hard floor. I remember a patient named Susan in her late 60s who came to me complaining that her knees felt like two rusty doors every night. She'd sit down after dinner, watch TV, and by the time she got up to go to bed, her joints were so stiff it took her several minutes just to walk to her bedroom. We started with a 10-minute evening sequence: gentle ankle circles, seated knee extensions, and slow standing hip rotations. Within 2 weeks, she told me she could walk to bed without that robot walk she used to have. She didn't just feel better, she moved better. The beauty of an evening routine is that it doesn't need to be complicated. We start with gentle mobility movements, small, slow circles for ankles, wrists, and shoulders. These are not meant to be stretches yet, but simply ways to remind your joints that they can still move freely. Even 1 minute of slow, controlled joint circles can warm up connective tissue and improve blood flow. It's a way of telling your body, we're not shutting down yet. Let's finish the day strong and loose. From there, I like to guide patients into light dynamic stretches. For example, standing with one hand on the back of a chair for support and gently swinging one leg forward and backward in a controlled motion. This movement lubricates the hip joint, engages the surrounding muscles, and improves balance. We keep it slow, no jerking or forcing the movement, because the goal is not to push limits, but to find comfort and flow. Over time, these little motions become habits your body craves because it remembers how good it feels afterward. Finally, I always include a short breathing component. People underestimate how much tension in the body is linked to shallow breathing and stress. When you take a few slow, deep breaths while gently moving, your nervous system shifts into a calmer state. This encourages muscles to release their grip around the joints and allows your body to prepare for deeper, more restorative sleep. I often tell patients, think of this routine not just as exercise, but as a daily conversation with your body. One where you're telling it, you're safe now, you can rest. When I start teaching an evening routine, I always begin with the joints that carry us the most: the ankles, knees, and hips. If you think about it, these joints spend the entire day absorbing the force of every step, every stand, and every shift of your weight. By the end of the day, they deserve a little attention. One of my favorite starting moves is the ankle circle. You can do this sitting on the edge of your bed or in a sturdy chair. Lift one foot slightly off the ground and slowly make big, gentle circles with your toes, like you're tracing a clock face in the air. Go 10 times in one direction, then 10 times in the other. This helps keep your ankle joint lubricated and your lower leg muscles relaxed. Repeat on the other side. After ankles, I move on to seated knee extensions. Sit tall in your chair, feet flat on the ground. Slowly straighten one leg out in front of you until your knee is almost fully extended, but without locking it. Hold for a moment, then lower it back down. Do this 8-10 times for each leg. This simple motion strengthens the muscles around your knees, keeps the joint moving smoothly, and can even improve circulation in the lower legs, which is important if you've been sitting for much of the day. For some of my patients, this is the first exercise that allows them to notice a decrease in stiffness after dinner. Next, I like to introduce hip rotations. Stand behind a chair, holding onto the backrest for balance. Lift one knee slightly and make slow, gentle circles with your thigh, moving from the hip joint. Think of it like polishing the inside of the joint. No sudden movements, no forcing. This not only helps with flexibility, but also with stability, as your standing leg works to keep you balanced. Alternate directions, 8-10 circles each way. Many people don't realize how much hip stiffness contributes to lower back pain until they start loosening this area up. Now, some people ask me why I focus so much on slow, controlled movements rather than intense stretching or resistance exercises in the evening. The reason is simple. At night, our goal is to prepare the body for rest, not to challenge it to its limits. Fast, high-intensity movements can actually wake up the nervous system, making it harder to wind down. Gentle mobility work, on the other hand, sends a calming signal to your brain and body, telling them that it's safe to release tension. This is why so many patients report sleeping better once they make this routine a habit. For example, I had a patient named George who was in his early 70s and struggled with both knee pain and insomnia. We added just these three moves, ankle circles, knee extensions, and hip rotations, to his evenings. He told me that not only did his knees feel less stiff in the morning, but he also found it easier to fall asleep. He described it as, like my body finally got the message that it was time to power down. That's exactly the effect we're looking for. Once you master these first steps, you'll notice a shift. Movements feel smoother, walking to bed feels easier, and your joints feel warmer and more fluid instead of cold and locked up. These changes may seem small, but over weeks and months, they build a foundation for healthier, more mobile joints. And remember, it's not about perfection. Even if you only manage 5 minutes some nights, your body will still thank you. While the lower body carries most of our weight, the upper body often carries most of our tension. Throughout the day, especially if you've been working at a desk, driving, or even just spending time on your phone, your shoulders creep upward, your neck stiffens, and your upper back rounds forward. This tension doesn't just stay in the muscles, it can spread to the joints, particularly in the shoulders, neck, and even the small joints of the spine. That's why, in the second half of the evening routine, I always address the upper body. These movements are just as important as those for your legs, because stiffness here can influence posture, balance, and even breathing. One of my favorite starting points is shoulder rolls. Stand or sit comfortably, letting your arms hang by your sides. Slowly lift your shoulders toward your ears, roll them backward, and then let them drop. Do this in a slow circular motion 8-10 times, then reverse the direction. This movement helps release built-up tension in the trapezius and surrounding muscles, improves circulation, and allows the shoulder joints to move through their natural range. It also opens the chest slightly, which is important for posture. I always tell patients, slow and smooth wins here. Rushing through won't give your joints the time they need to respond. After shoulder rolls, I move to shoulder blade squeezes. Sit or stand tall, arms at your sides or bent at 90 degrees. Gently squeeze your shoulder blades together as if you're trying to hold a pencil between them. Hold for 3 to 4 seconds, then release. Repeat 8-12 times. This activates the muscles that support your posture and counteracts the forward rounding that many people develop over the years. For patients with arthritis in the spine or upper back, this small but consistent movement can help relieve pressure and even make breathing feel easier. From there, I introduce a simple neck mobility sequence. Begin by sitting tall. Slowly turn your head to look over your right shoulder, hold for a breath, then return to center and repeat on the left side. Next, gently tilt your ear toward your shoulder, hold and switch sides. Finally, drop your chin toward your chest, then lift it slightly toward the ceiling, but without forcing it back. Each of these moves should be done slowly, never pushing through pain. The neck contains delicate joints, and this routine helps keep them flexible while reducing tension in the surrounding muscles. I've had patients tell me that doing this before bed helped reduce their nighttime headaches. Once the shoulders and neck are relaxed, I like to work on upper back mobility with a seated twist. Sit on a sturdy chair, feet flat on the floor, hands resting gently on your thighs. Slowly turn your upper body to the right, bringing your right hand to the back of the chair for support, and take a deep breath into the stretch. Return to center and repeat to the left. Twists help keep the spine mobile and also engage your core muscles in a gentle way, which can improve stability and reduce strain on the lower back. I remember one of my patients, Margaret, who came to me with persistent shoulder stiffness that made it hard to reach up into cabinets. She assumed it was just getting old, but the truth was that years of hunching over a computer had left her joints and muscles tight and weak. When we added shoulder rolls, blade squeezes, and gentle twists to her nightly routine, she started noticing more freedom of movement within a month. She told me that for the first time in years, she could take her coat off without struggling to pull her arms through the sleeves. The beauty of this upper body sequence is that it doesn't just target the joints themselves, it also improves blood flow and signals the nervous system to relax. As your shoulders drop and your neck muscles release, your body begins to shift toward a more restful state. This is essential for joint recovery because a calm nervous system means less muscle guarding and better circulation of nutrients to the tissues. When I guide patients through this routine, I remind them that evening mobility work is not about pushing limits, but about creating space in the body. Think of it as gently opening the windows after a long, stuffy day, letting fresh air in and allowing everything to move more freely. These small, deliberate motions may feel simple, but they prepare your joints and muscles for the deep, restorative rest they need to heal. After working through mobility for both the lower and upper body, the next step I guide my patients into is gentle stretching. This isn't the kind of stretching you might remember from gym class. There's no bouncing, no forcing, no holding your breath. Evening stretching is about lengthening tight muscles and easing the pressure on the joints they support. Many people don't realize that when muscles are tight, they can literally pull on the joints, keeping them in a state of constant strain. Releasing that tension, especially before sleep, is one of the most powerful ways to give your joints the relief they need overnight. I like to start with a seated hamstring stretch. Sit on the edge of a sturdy chair, extend one leg straight in front of you with the heel on the floor, and keep the other foot flat for stability. Slowly hinge forward at the hips, keeping your back straight until you feel a gentle stretch along the back of your thigh. Hold for 15-20 seconds, breathing deeply, then switch legs. This stretch relieves tension in the hamstrings, which, when tight, can pull on the pelvis and affect the lower back and knees. I've had patients tell me that adding just this stretch reduced their nighttime lower back pain significantly. From there, I move to the calf stretch. You can do this standing at a wall or behind a chair for support. Step one foot back, press the heel into the ground, and lean slightly forward until you feel a stretch in the calf of the back leg. Hold for 15-20 seconds, then switch sides. This is especially helpful for people who have spent the day on their feet because tight calves can make the ankle joint stiff and affect how you walk, creating more stress on the knees and hips. For the hips, one of my favorite evening stretches is the seated figure 4 stretch. Sit in your chair, place your right ankle over your left knee, and gently lean forward until you feel a stretch in the outer hip and glute. Hold for 20 seconds, breathing deeply, then switch sides. This stretch helps release the piriformis muscle, which can become tight and contribute to hip pain or even sciatic nerve irritation. I've worked with patients who said this single stretch helped them get out of bed in the morning without that first jolt of hip stiffness. Next, I bring attention to the spine and shoulders with a gentle side stretch. Sit tall or stand with feet shoulder width apart. Raise one arm overhead and slowly lean to the opposite side, feeling the stretch along your side body, ribs, and lower back. Hold for 10-15 seconds, then switch. This movement helps keep the spine mobile and also opens the rib cage, which improves breathing, a small but important detail for evening relaxation. Now, once we've completed these stretches, I integrate deep breathing techniques. Many people underestimate the role breathing plays in joint health, but when you breathe deeply, you activate the parasympathetic nervous system, the body's rest and repair mode. This reduces muscle tension, lowers inflammation signals, and prepares you for quality sleep. I recommend the 4 to 6 breathing method. Inhale slowly through your nose for a count of 4. Let your belly rise, then exhale through your mouth for a count of 6. Repeat for 5 to 10 cycles. The longer exhale signals your body to relax. To make the transition from movement to rest even smoother, I sometimes guide patients through what's called progressive muscle relaxation. Starting from the feet, you gently tense each muscle group for a few seconds, then release. Move up through the calves, thighs, hips, abdomen, hands, arms, shoulders, and face. This teaches your body the difference between tension and relaxation, something many people have forgotten after years of chronic stress and pain. I remember working with a gentleman named Robert, who had arthritis in both knees and chronic tension in his shoulders. We built him a 10-minute evening sequence combining the stretches I've just described with deep breathing and progressive relaxation. 2 weeks later, he told me that not only had his evening stiffness improved, but he was also sleeping through the night for the first time in years. "It's like my body finally understands the day is over," he said. "That's exactly the goal, to help your body and joints shift from holding on to letting go." Evening routines like this don't just make you feel better tonight. Over time, they create a new baseline for your body, one where stiffness is less frequent, movements are smoother, and pain doesn't dictate how you live. I often tell my patients, these 10 minutes are an investment. You're putting small amounts of time into something that will pay you back every single morning when you wake up feeling freer and lighter. By this point in the routine, your joints are warm, your muscles are more relaxed, and your nervous system has already started to shift toward a calmer state. This is the perfect time to add a few gentle strengthening exercises. Now, I know the word strengthening can make some people nervous in the evening. After all, you don't want to get your heart rate racing before bed. But what I'm talking about here isn't heavy lifting or high-intensity training. These are slow, controlled, low-resistance movements that keep your muscles active without overstimulating your system. Why include strengthening at night at all? The answer is simple. Strong muscles protect your joints. Every time you walk, climb stairs, or even get out of a chair, the muscles surrounding your joints act like shock absorbers. If those muscles are weak, more stress gets transferred to the joint surfaces, leading to pain, inflammation, and stiffness. By giving those muscles a small but consistent challenge in the evening, you keep them engaged and ready to support you, without the risk of straining them. Let's start with mini squats at the chair. Stand behind a sturdy chair, feet hip-width apart, and place your hands lightly on the backrest for balance. Slowly bend your knees and lower yourself just a few inches, as if you're about to sit down, then return to standing. The movement should be gentle. You're not going for depth here, but for control. Do 8-10 repetitions, keeping your knees aligned with your toes. This exercise works the quadriceps, hamstrings, and glutes, the main support muscles for your knees and hips. Many of my patients who struggled with knee pain told me this small evening habit made walking upstairs easier within a month. Next, we'll work on calf raises. Stand with your hands on the chair for stability. Slowly lift your heels off the ground so you're standing on your toes, hold for 2 seconds, then lower them back down. Perform 10 to 12 repetitions. This strengthens the calf muscles and improves ankle stability, which in turn reduces the load on the knees. It also helps with circulation, reducing the swelling that some people experience in their lower legs by the end of the day. For the hips, I recommend side leg lifts. Stand tall, holding the chair with one hand for balance. Slowly lift one leg out to the side, keeping it straight and your toes pointing forward. Pause, then slowly lower it back down. Repeat 8-10 times per side. This targets the hip abductors, which are crucial for balance and for reducing strain on the hips and knees during walking. I had a patient named Linda who was worried about her wobbly balance. Within 6 weeks of adding side leg lifts into her evening routine, she felt steadier and more confident on her feet. Moving to the upper body, one simple but effective move is the wall push-up. Stand facing a wall, feet about 2 feet away, and place your hands at shoulder height on the wall. Bend your elbows and slowly lean your body toward the wall, then push yourself back to the starting position. Perform 8-10 repetitions. This works the chest, shoulders, and triceps without putting too much pressure on the wrists. For patients with shoulder stiffness, I suggest keeping the range of motion small at first and focusing on smooth movement. Another excellent exercise is the seated resistance band pull apart. Sit tall, holding a light resistance band in front of you with both hands at shoulder height. Gently pull the band apart until your hands move out to your sides. Squeezing your shoulder blades together, slowly return to the starting position. Repeat 8 to 12 times. This strengthens the upper back muscles, which are essential for good posture. And good posture means less uneven loading on the spine and hips. One of the things I emphasize to patients is that these strengthening moves are not meant to exhaust you. In fact, you should feel like you could do a little more when you stop. That's how you know you're not overworking your joints before bed. The idea is to maintain and build muscle tone over time, not to break it down. That's why I often say, think of this as feeding your muscles, not draining them. I remember a patient named James who was hesitant to do any strengthening work in the evening. He worried it would make his pain worse or keep him awake. But we started slowly, just mini squats, calf raises, and wall push ups. Within 2 weeks, he noticed not only less pain climbing stairs, but also fewer nighttime aches. He told me, "It's like my body feels supported from the inside now." Once you finish these strengthening moves, it's important to end with a few calming breaths and perhaps a short stretch for any muscle that feels tight. This sends the final signal to your body that it's time to rest, not stay alert. Remember, the consistency of these small movements matters far more than intensity. Done night after night, they build a protective armor around your joints, allowing you to move more freely and with less pain during the day. By the time you've gone through mobility, stretching, and light strengthening, your joints are already in a much better place than they were 10 minutes ago. They're warmer, better lubricated, supported by active muscles, and free from the stiffness that built up during the day. But there's one last crucial step to truly seal in the benefits of the evening routine: the recovery phase. Think of it as the cool down for your joints and your mind, the bridge between movement and rest. Without it, your body can stay in a slightly alert mode, which can reduce the quality of your sleep and slow down overnight repair. I always begin this phase with guided breathing combined with gentle positioning. Sit or lie down in a comfortable position. For many patients, lying on the bed with a pillow under the knees is ideal for taking pressure off the lower back and hips. Close your eyes, place one hand on your belly and one on your chest. Inhale slowly through your nose for a count of 4, feeling your belly rise under your hand, then exhale gently through your mouth for a count of 6. Repeat for at least 10 cycles. This not only calms the nervous system, but also increases oxygen delivery to the muscles and joints you've just worked. After breathing, I often recommend passive joint support. This means placing pillows or cushions in positions that reduce strain on your joints. For example, if you have knee pain, a small pillow between your knees while lying on your side can keep the hips and knees aligned, reducing pressure. For shoulder discomfort, hugging a small pillow can prevent the joint from collapsing forward during sleep. These small adjustments can make a big difference in how you feel when you wake up. Another technique I like to use is gentle self-massage. You don't need fancy equipment, your hands will do. Lightly massaging around the knees, calves, or shoulders with small circular motions can help increase blood flow and further relax the muscles. For patients with arthritis, this can also help move excess fluid away from swollen joints. I remember a patient named Carol who began ending her evening routine with just 2 minutes of light knee massage. She told me it felt like turning off a dimmer switch on the pain. At this stage, we also talk about temperature therapy. If your joints feel achy or inflamed, applying a warm compress or heating pad for 10-15 minutes can improve circulation and ease stiffness. On the other hand, if there's swelling from a day of activity, a cool pack for a short time can help calm inflammation. Some of my patients alternate warm and cool treatments, which can be surprisingly effective for pain control. Now, here's something many people overlook. What you do in the 30-60 minutes after your evening routine can either boost or undo its benefits. If you go right back to sitting hunched over your phone or working on your laptop in bed, you may be reintroducing the same tension you just worked to release. Instead, I suggest a gentle transition into your bedtime. Maybe reading in a supportive position, listening to calming music, or practicing a relaxation exercise. Avoid heavy meals, excessive screen time, or stressful conversations, as these can keep your body in a heightened state. One more habit I encourage is hydration. Even though you're winding down, sipping a small glass of water or herbal tea before bed can help your body replenish fluids. Joints rely on proper hydration to keep the synovial fluid, the oil in your joints, at the right consistency. Just don't overdo it right before sleep to avoid nighttime awakenings. Finally, I like to remind my patients that this evening routine is not just about today. The real magic comes from making it a non-negotiable part of your day, like brushing your teeth. Over weeks and months, your joints will begin to expect this care, and you'll likely notice less stiffness in the morning, greater ease of movement throughout the day, and even better sleep. One patient, Frank, told me, "At first I thought 10 minutes wouldn't do much, but now I can't imagine ending my day without it. It's like tucking my joints into bed." So, as you finish your routine, take a moment to feel the difference in your body, the warmth in your joints, the looseness in your muscles, the calm in your breathing. This is your body's way of saying thank you. You've given it the tools to repair, recover, and wake up tomorrow, ready to move with more freedom and less pain. And that, to me, is the best investment you can make in your health.